Representative O'Rourke, you have addressed your 1998 DWI arrest numerous times during your public career, but not this question. As the Houston Chronicle pointed out recently, a witness said in that accident that you tried to leave the scene of the accident. Did you, and should voters be concerned about this incident?
Yeah. I did not try to leave the scene of the accident, though driving drunk, which I did, is a terrible mistake for which there is no excuse.
As the Houston Chronicle pointed out recently, a witness said in that accident that you tried to leave the scene of the accident. Did you, and should voters be concerned about this incident?
Yeah. I did not try to leave the scene of the accident, though driving drunk, which I did, is a terrible mistake for which there is no excuse. Or justification or defense, and I will not try to provide one. I can only tell you that I was able to have a second chance in my life. I was able to start a small business with good friends in El Paso, was able to meet Amy on a blind date before Tinder, raised 3 amazing kids with her, Ulysses, Molly, and Henry, serve my community on the El Paso City Council, and represent 750,000 people from my community in the United States Congress. I've made the most that I could with my second chance and my opportunity. What I do know is that as a white man in this country, there's a privilege that I enjoy that many African-American men and women do not. They do not have that second chance. They're forced to check that box on an employment application form that makes it harder for them to get a job. They're ineligible for the Pell Grants that would allow them to attend SMU or TCU or any institution in this area. And their choices are narrowed, their options are constrained in their lives. Everyone deserves a second chance, and if my experience can contribute to an understanding that allows me to work with Republicans and Democrats alike on real and meaningful criminal justice reform, to ensure that everyone is able to live to their full potential and no one's mistake defines them for the rest of their lives, and that will be something good in whatever meaningful way it is that has come out of that terrible decision on my part.
That's your time, Congressman. Senator?
You know, I don't intend to get into Congressman O'Rourke's personal history, but I will keep the focus on issues and substance and record, and I will say as a member of Congress, he introduced legislation that would make it easier for those with drug convictions to get driver's licenses. I think that's a real mistake, and it's part of a pattern. There's a consistent pattern when it comes to drug use that in almost every single instance, Congressman O'Rourke supports more of it. So when he was on the El Paso City Council, he's one of the leading advocates in the country for legalizing marijuana. He wrote a book about that. Now, legalizing marijuana is actually a question on which I think reasonable minds can differ. I've always had a libertarian bent myself. I think it ought to be up to the states. I think Colorado can decide one way. I think Texas can decide another. But I'll tell you, Congressman O'Rourke didn't stop with marijuana. He introduced and he advocated for a resolution in the El Paso City Council calling for a national debate on legalizing all narcotics. That includes heroin and fentanyl and cocaine. And let me say, that is not, I believe, a reasonable issue on which people can disagree. Now, I suspect Congressman O'Rourke will say, we was just calling for a debate on it. Well, we're on a debate stage now. I will tell you, I think it would be a profound mistake to legalize all narcotics, and it would hurt the children of this country. That would be a serious mistake.
Senator, that's your time.
I agree with you.
Representative, please.
To be clear, I don't want to legalize heroin and cocaine and fentanyl. But what I do want to ensure is that where in this country, most states have decided that marijuana will be legal at some form, for medicinal purposes, for recreational purposes, or at a minimum will be decriminalized, that we don't have another veteran in this state prescribed an opioid because the doctor at the VA would rather prescribe medicinal marijuana but is prohibited by law from doing that. Another older woman with fibromyalgia who's not able to use medicinal cannabis because it's against the law here, and another African-American man, because more likely than not, that's who will be arrested for possession of marijuana, to rot behind bars instead of enjoying his freedom and the opportunity to contribute to the greatness of this country. Yes, I want to end the war on drugs and specifically want to end the prohibition on marijuana.
And Grover, let me point out, he didn't dispute that as 9 years ago, as an elected member of the El Paso City Council, he introduced and advocated for energetically debating ending the prohibition on all narcotics, on everything. He says he doesn't agree with that now, but that was only 9 years ago. And I'll tell you, when it comes to this, this is an issue that's personal to me. My older sister, Miriam, died of a drug overdose. People all across the state of Texas, 70,000 people a year are dying of drug overdoses in this country. We have an opioid crisis. And I think talking about legalizing all narcotics, I think that is profoundly dangerous, and it doesn't represent the interest of Texans.
All right, Senator.
That's your time. And Senator Cruz, you get the next question. You fought for the repeal of the Affordable Care Act, but Texas has the highest rate of uninsured people in the nation, and more than 1 million residents signed up through the federal marketplace this year. How do you propose addressing the health care needs of Texans?
I believe Obamacare has hurt millions of Texans. It was sold to the people of this country on a promise from President Obama: if you like your health insurance plan, you can keep it. If you like your doctor, you can keep it. PolitiFact, the left-leaning organization, rated that 2013's lie of the year, as millions of Americans had their health insurance canceled against their will. But the biggest reason people are unhappy with Obamacare is it's made their premiums skyrocket. I hear from Texans all over this state, I can't afford health insurance. President Obama promised the average family's premiums would drop $2,500 a year. In fact, they have risen over $5,000 a year. When Obamacare was implemented, the most inexpensive plan for a 30-year-old healthy man here in the Dallas area was $363 a year. Today, in this zip code where all of us are right now, a bronze plan for a 30-year-old healthy man is about $3,000 a year. A silver plan is over $4,400 a year. That's going from $363 to, in just a few years, increasing over tenfold. That's not right. What do we need to do? We need to lower premiums for everyone. How do we do that? We can protect pre-existing conditions, and you need to understand, everyone agrees we're going to protect pre-existing conditions. But we also need more choices, more competition, more options so that prices drop, so that young people coming out of SMU or coming out of schools across this country can afford health insurance instead of facing the disaster that Obamacare has done to our health care system.
And that's your time, Senator. Representative?
I don't know how you're going to repeal every single word of the Affordable Care Act and keep protections for pre-existing conditions. Keep protections for Victor, who's the son of our new friend Laura Lehman, who we met. Victor has cerebral palsy, has uncontrolled seizures, is incredibly expensive medically to keep alive. He's a medically complex child, but his life is worth just as much as anyone else's life in this country. I want to make sure that we keep those pre-existing condition protections for Victor. I want to make sure that we improve and stabilize the Affordable Care Act. I want to make sure that I never meet another young man like Joey in Laredo, 29 years old, has diabetes, now has glaucoma, does not have health care. And so the one time that he did see a doctor, that doctor said, you will be dead before you are the age of 40. And as he gets closer to death and takes himself to the emergency room, as the suffering becomes too great, the outcomes will not be as good as they would have been otherwise if we had invested up front, and the care will be disproportionately more expensive. I want to make sure that we also expand Medicaid. This state left $100 billion on the table that could have provided care for people in this community, introduce Medicare as an option on the exchanges, and then get to universal, guaranteed, high-quality health care for every child, for every woman, for every man in this state and every state in the union.
Representative, that's your time. Senator Cruz.
You know, it was striking that Congressman O'Rourke didn't have a word to say to the millions of Texans whose premiums have skyrocketed. He talked about pre-existing conditions, but every one of us agrees pre-existing conditions must be protected. And indeed, when we were debating Obamacare, I introduced legislation called the Consumer Freedom Amendment that would protect pre-existing conditions, but that the Health and Human Services Agency ran the numbers and found the Consumer Freedom Amendment allowing people to purchase the health insurance that you want would reduce annual premiums about $5,000 a year. We've got to lower premiums, and Congressman O'Rourke has voted 67 times to keep Obamacare. He hasn't been there to fix the people that are getting hurt, that are forced into part-time jobs. Instead, his answer is socialized medicine. Socialized medicine is a mistake, and it would hurt the people of Texas.